Good evening, everyone. My name is Michelle Sanford, and I'm the Public Relations and Community Benefits Manager for UMass Memorial Health, Milford Regional Medical Center. It's my pleasure to welcome you all to our program this evening. A few things to note: the webinar is being recorded. The raise hand function will be disabled. There will be a question and answer portion at the end of the webinar, and you can type your question anonymously at any time through the Q&A icon on the bottom of your screen. And finally, we will be emailing a very short survey to attendees to provide us feedback on this program. Tonight, UMass Memorial Milford Regional brings you Commit to Quit, the positive impact of quitting smoking cigarettes and the latest methods to help you, featuring Dr. Ryan Shipe and physician assistant Christopher LeSiege. Dr. Shipe is a pulmonologist and critical care specialist at UMass Memorial Milford Regional. He graduated from Jefferson Medical College of Thomas Jefferson University in Pennsylvania and completed his residency at Brown University Medical School. He completed his fellowship at the University of Virginia Medical Center in pulmonary and critical care. He is board certified in critical care medicine, internal medicine, and pulmonary disease. Mr. Christopher LeSiege is a physician assistant in the Department of Thoracic Surgery at UMass Memorial Milford Regional. He received his master's degree in medical science, physician assistant certificate from Emory University School of Medicine's physician assistant program. Chris completed the tobacco treatment specialist training program at the University of Massachusetts Medical School. Both of our panelists are also co-directors of the Lung Cancer Screening Committee and Pulmonary Nodule Board. And I'd also like to thank Liz Fleming from the foundation for helping us out tonight. So right now it's my pleasure to turn the webinar over to Chris.
Great. Thank you, Michelle, for the introductions this evening. I'd like to start on behalf of Dr. Shipe and myself to just personally congratulate and welcome all of the participants that signed up for this webinar this evening. I truly hope that this provides a solid foundation on your journey towards your efforts to quit smoking. To start, I'd just like to give a brief history of how tobacco came to be and some of the statistics that are relative to smoking. Tobacco has been around in the Americas dating back over 8,000 years. Christopher Columbus was the first European to discover smoking. And by the early 1600s, tobacco was being used as a monetary standard across Europe and England, and that continued well into the 1700s, where the tobacco industry started to truly develop. Next slide. By the early 1800s into the 1900s, several events took place, including the advent of the match in 1805. And then the cigarette machine was invented in around 1880, at which time the machine was able to produce about 200 cigarettes a minute, as opposed to about 9,000 per minute on our modern day machines. During this time, the magazines of that time started heavily advertising the use of cigarette smoke, particularly young boys and to overseas markets. Next slide. By the early 1900s, R.J. Reynolds became the world's first company to develop the cigarette under the brand name of Camel. And this took off very quickly. This cigarette was marketed at a heavily discounted price. And due to the success of the Camel brand, many other brands quickly followed suit, and consumption of cigarettes rapidly developed for several decades. During this time, heavy marketing continued and was associated with the false sense of improved health, thinness, weight reduction, and the such. Next slide, please. It didn't until the early 1950s is when we really started recognizing some of the health hazards of cigarette smoking. And there were several publications that came out that clearly outlined some of the health effects and dangers of cigarette smoking. These health effects were dismissed at that time as puritanical preaching, and the cigarette companies responded by adding filters to their cigarettes uh, with real no evidence of increased safety. Despite all of the clear evidence of the dangers of cigarette smoking, aggressive marketing continued, and they basically continued to show a public face of complete denial. Next slide, please. So, some of this appropriate statistics, smoking is the number one factor for lung cancer in the United States and is linked to about 80 to 90% of lung cancer deaths in the United States currently. Of course, there are additional risk factors such as secondhand smoke and exposure to additional toxins such as radon. Lung cancer does remain a leading cause of death, accounting for approximately 25% of all cancer deaths amongst males and females. Lung cancer also disproportionately affects certain population groups. It is also the leading cause of preventable disease and death in the United States, unfortunately, killing almost 500,000 Americans each year. Globally, tobacco use kills more than 8 million people each year, including 1.3 million non smokers who are exposed to secondhand smoke. It also remains the leading cause of preventable disease and death in the United States, with nearly 1 in 5 US adults reporting current tobacco use in the United States as of 2022. Next slide, please. So, the tobacco causes many problems for people, including lung cancer, as previously outlined, cardiovascular, lung diseases. It is associated with an increased risk of cancers of the mouth, esophagus, and pancreas. And while tobacco use in the United States decreased from 2019 to 2022, nearly 15 million adults continue to use cigarettes and e-cigarettes in 2022. Next slide, please. So that brings us to the point of why is it so hard to quit smoking? Well, it's pretty simple. It's because these cigarettes contain nicotine. So tobacco addiction really is nicotine addiction. There's many different factors that are involved in terms of pharmacologic, genetical, social and environmental factors, including design and marketing that continues by some of the tobacco producers. Next slide, please. Some of the effects of nicotine include release of several neurotransmitters that are outlined below. I won't go through all of these, but a lot of these neurotransmitters result in pleasure stimulation, appetite suppression, arousal, and cognitive enhancement. Next slide, please. So the cigarette is actually a perfect delivery system for nicotine. Cigarette smoke is very acidic and it is rapidly absorbed through the lung and into the brain within 7 to 10 seconds of smoking a cigarette. Once the nicotine reaches the brain, it causes the release of the neurotransmitters that are outlined on this screen. And as people continue to smoke, the the brain develops what we call neuroadaptation or tolerance with repeated exposure to nicotine. This leads to the receptors, the nicotine receptors, becoming desensitized or almost unresponsive. So, what the brain does is compensates by increasing the number of receptors and binding sites within the brain, which makes it even harder to quit smoking. And after a brief period of abstinence, the receptors become responsive again, which results in some of the withdrawal symptoms and cravings. Next slide. So, as I previously said, cigarette smoke is very acidic. It's absorbed primarily in the lungs. Uh, Even light cigarettes can deliver as much nicotine as the low tar or the lighter cigarettes. Most cigarettes will deliver approximately 1 to 2 milligrams of nicotine per cigarette. And it is, as I said previously, it is a very highly engineered drug delivery system. Next slide. So, some of the psychological effects previously mentioned: stimulation, arousal, relaxation, stress reduction, mood regulation, appetite suppression, weight management, and then, of course, cognitive effects such as enhanced memory, enhanced attention, and increased speed of processing. These are all the effects that occur through cigarette smoking. So it is very obvious that these are not bad effects. They are effects that most people would want to experience, but is one of the main reasons why people have such a difficult time quitting smoking. Next slide, please. So, nicotine withdrawal is where the real problem comes in. This is where the exact opposite happens. People develop irritability, frustration, anger, anxiety, concentration difficulties. Appetite can come back up. They can become restless, depressed. People can develop insomnia. The withdrawal symptoms usually peak in about 2 to 3 days after quitting. And for most people, the symptoms are gone within 2 to 3 weeks. Unfortunately, for some people, these symptoms take a lot longer to disappear and can take up to several months. And some of the physical symptoms, such as sleep disruption and the appetite issues, may persist for months to over a year. Next slide, please. So now it's my pleasure to turn the next part of our talk over to my esteemed colleague and good friend, Dr. Ryan Shipe.
Yeah, thanks so much, Chris. Really appreciate what you did there. That's all really interesting background, and hopefully we'll be able to help folks on this call. So just to begin, first of all, I echo what Chris said earlier in the talk. I mean, if you're motivated enough to get on a webinar like this at 6:30 and listen to us for a little while, I mean, you're definitely you're definitely there, I think, in trying to quit. And I'm sure you've tried to do it before, and as you can imagine, I've had this talk a lot of times with people in my office hours and so on, and I'm well aware of how hard it is, and what a struggle it is. And it's most definitely not someone's fault, an individual's fault or a failure. It's just that hard. I mean, nicotine is that powerful of a drug, and it really sucks you in and keeps you there. So I do commend you for being on this call, and like I said, like Chris said, I hope we do provide some value for you, give you some information, and get you motivated to make a positive change for yourself. And I can say, without a doubt, quitting smoking is the by far the best thing you can do for your health. At any stage. I mean, you could. I hear this a lot, where if people already have lung diseases or even lung cancer, that it's very easy to talk yourself out of quitting smoking. But even if you do have something like that, there's still a lot of benefit to be had for people, and you can do a lot of good for yourself. And I think when we talk about treatment, the first thing I talk about with people is first of all, it's not easy, as most of you probably know, but also that the first thing you have to do is really get your motivation up, and that's because I'm sure there's something out there about this, but somehow nicotine, and this addiction to cigarettes and nicotine is really it really changes the way you look at this a little bit, and it really just keeps you hooked. So the first thing you really have to do is motivate yourself by thinking about the the good you can do for yourself, the good you can do for your family and others that are around you. And also there are health benefits, but there are social benefits. There are lots of different reasons to quit smoking. Um, so I think the first thing to do is to get your motivation up. While you're doing that, cutting back with a gradual reduction method, I think, is a really effective way to at least begin. And then you can approach your quit date with a little bit of a success already. Um, but what we're really going to focus on for the rest of the talk is the medicines that we can provide in order to help. And what I like to tell people is, you know, most of this is done on your own. And I don't want to say that we don't have any effect with the medicines, but I do believe that people's motivation and your will, your wantingness to your desire to do this is a lot of it. And then the medicines that we have definitely take the edge off. They definitely help. But I think it's kind of a strategy on multiple fronts that can be done. But now I'll talk about the medical treatments, and which fortunately we do have a lot of options. So, in thinking about this first slide, the thing I want you to take away from this is, um, you know, many people want to quit. Um, they're not always successful the first time around, but I will tell you that the more people try, the more likely they are to quit. So, um, but I think having a good strategy um, with your doctor or primary care provider, um, in addition to your own motivation, is the best way forward. Um, eh, you know, like I said, it is the chance of you quitting smoking is doubled by using medical treatments, which include nicotine replacement and some of the FDA approved medicines for smoking cessation, which include bupropion, Wellbutrin, otherwise known as Zyban, or varenicline, which is commonly known as Chantix, which I'll get into more details a little bit later on in a few minutes. Um, and clinical guidelines do recommend using medicines in addition to um, nicotine replacement in order to help. Um, I do have a lot of people who are not interested in having smoking cessation aids, which of course is entirely fine. It's obviously an individual's decision. What I can tell you is these things really do help, and you know there isn't a huge downside to using them. They are covered by insurance. Some of them are over the counter. So I think it would be a good thing to consider if you think if there might be a good option for you. And an important part of this slide, in bold here we have that combination pharmacotherapy or combination medicines is more effective than using a single medicine. So, Michelle, if you could move on to the next slide, we'll talk about that a little bit. So like I said, I mean, there's single agent therapy, which are, there's about 7 different medicines or nicotine replacement that you can use. There are a couple of second line medicines as well. They're not FDA approved, those of which I'm not going to talk about today because they're not FDA approved. Although they are used in other countries, such as European countries. But when I talk about combination therapies, I'm talking about mostly either the nicotine patch plus short-acting nicotine replacements, such as the gum, lozenges. There's a nasal spray. You can also use bupropion or Zyban or Chantix plus nicotine replacement. Essentially what you have, you can use different combinations of the different modes available. And we do know that providing 2 medicines together, they work synergistically, right? So they work at the problem from different angles, which can be very, very helpful for people. Next slide, please. And this slide really talks a little bit more of the same that I've already said, but essentially, again, you have Wellbutrin, which is Zyban, which is an antidepressant. You have Chantix, which is essentially a, a, a medicine that blocks the nicotine receptor in the brain. It has a kind of a novel action, and what it does is it reduces the pleasurable effects of smoking and also reduces cravings to some degree. While Butrin does something similar, and then nicotine replacement, of course, it replaces some of the nicotine and reduces that's in your that you're used to, and it reduces the cravings and withdrawal symptoms that you might suffer. So I think what I'll do, if we could go to the next slide, please. First, I'll talk about nicotine replacement. As I said, nicotine replacement is exactly what it sounds like, right? It's pretty straightforward. You have a nicotine addiction by supplementing nicotine into your system, which can treat the cravings that you have, but avoid some of the unhealthy effects of smoking, is makes sense as an approach. And nicotine replacement itself is not dangerous like smoking. I mean, the dangerous effects of smoking are all of the other things that are in the smoke, but not necessarily the nicotine itself. Nicotine is what keeps you coming back to cigarettes and is the addictive chemical in cigarettes. However, so it depends on how much you smoke, and it depends on how strong your cravings are for nicotine. But we use that in order to help us determine what strategy to use. So in nicotine replacement in the form of patches or other things, which I'll go into each individually in just a minute, it does provide partial replacement for nicotine. It reduces withdrawal symptoms. It may provide some of the positive effects of nicotine, such as a desirable mood or improved attention span. One of the drawbacks is that the patches or the gum does not deliver nicotine as quickly as inhalation from a cigarette. And so, although it is trying to reproduce the nicotine effect that you get from cigarettes, it's not exactly the same. But we can approximate to some degree, and I can explain how we do that on the next slide, if you don't mind, Michelle. Yeah. Let's see. Yeah, so just looking at this a little bit. So, like I said, you have the nicotine patch, which most people are familiar with. The nicotine patch comes in the different doses: the 21 milligram dose, the 14 milligram dose, and the 7 milligram dose. Typically what I do is I think about how much you're smoking, and then I can base the dose of the patch on the amount of smoking. So, and my rule of thumb is typically if you're smoking a pack a day or more, I usually will use the 21 milligram patch. If you're around half a pack or 10 to 20 cigarettes a day, I'll use the 14 milligram patch. And then if you're less than 10 cigarettes a day, 5 cigarettes a day, something like that, I'll use the 7 milligram patch. It's the patches are placed on the skin once a day. You wear it for 24 hours. It provides what I would call a basal level of nicotine that is absorbed through the skin over the course of 24 hours. Then it is replaced in 24 hours. People will have, or often will have, breakthrough symptoms. Despite the nicotine patch. And so that's where you might have used something like the nicotine gum, nicotine lozenges. There is an inhaler, or was an inhaler. The Nicotrol inhaler was discontinued in 2023. Hopefully, it's available again because I think it's a pretty useful tool. But there is a nasal spray which is similar. Um, what I can tell you about these things is that they are effective for breakthrough cravings. I really should tell you what it tastes like. I've never actually tried it, so but I probably should, right? Because people tell me it doesn't taste the best, but still, it serves the function. So I'm not trying to get you to not take it, but I'm told it's not the best. There are flavors. Apparently, they're better. There are lozenges, there are gum. They each of the lozenges and gum come in 2 milligrams and 4 milligram doses. Typically, if you're craving a cigarette pretty quickly in the morning, we would use the higher dose nicotine gum or lozenge. If you don't crave a cigarette immediately within 30 minutes of getting out of bed, you're typically good to use the 2 milligram dose. You can use them every hour. So you can basically chew gum or lozenges all day long if you want to. Just to put it into a little bit of perspective, a single cigarette is about 1 to 1.5 milligram of absorbed nicotine. Okay, so for example, if you chew a 2 milligram piece of gum, that's going to be roughly 1 to 2 cigarettes. Same with the lozenge. The nasal spray is I believe it's 0.5 milligrams each spray. So if you spray it in each nostril, it's once it's about 1 milligram, or a partial cigarette. So that's how you would approximate how much nicotine you're getting in response to the amount of cigarettes that you're used to. Okay. But you can use it frequently. The gum and lozenges, you don't get a nicotine surge immediately. The spray is actually more approximates actual cigarettes. I will admit, I've used the inhaler, which I had good success with. I've never used the spray, but after doing some research about this talk, I'm interested in trying it. I think it's a good option for people. The thing about the inhalers and the sprays, I mean, people will often talk about not just the nicotine cravings, but they'll also talk about the need for something in their hands. And the inhaler and the spray is a nice option for that, because it kind of gives you something to fiddle with, and approximates that feeling that people have when they have a cigarette in their hand. And so what we do know is that when you combine the nicotine patch plus short-acting gum or lozenges, we do have a higher rate of abstinence from smoking. So we do know that probably combination therapy is more effective than single-use nicotine patches. And importantly, this is another thing that people do ask about. Will you develop nicotine toxicity because this seems like you're getting a lot of nicotine? The answer is no. I mean, this typically does not happen. People will also ask, can you smoke with the nicotine patch on? In truth, you can. Of course, we would, recommend not. But if you slip, you're not going to harm yourself. I have had a few people have a little more nicotine than they should have by smoking or using the gum and smoking and doing all of this at the same time. The truth is, again, I'm not advocating developing nicotine toxicity or nicotine poisoning. It mostly just makes you kind of uncomfortable. It's not a dangerous problem. It causes some nausea, lightheadedness, headaches. Again, I'm not suggesting you try to develop it, but you would feel that nausea and so on, and you would know to hold back on further nicotine. But again, we do know that this is safe therapy, and I think I've seen that once by giving these therapies. So we're not talking that this is a common thing. But you would start to feel a little bit ill if you were getting a little more nicotine than you're used to. Next slide, please. Oh yeah. Oh yeah, there we go. Okay. And again, it just this is a slide talking about the gum and the patch and the spray and the inhalers. Um, Again, these are all pretty effective. What we do know is that the compliance rate with the patch is highest because it's once a day. It's pretty easy to put that on, and then hopefully forget about it. Um, the gum and the spray and the inhaler, the lozenges, all of these things are more active that you have to do throughout the day. So the compliance with this is of course lower. But again, if it's something that you are used to using and you have it as a tool, I would strongly recommend using both the patch and one of the short acting modes that we have. Definitely people can use try to quit smoking with just the gum, just the nasal spray, just the lozenges. Um, and you can use it every hour, every 2 hours. That is a fine way to do it. But like I said, it is harder to be consistent with that throughout the day. So I think easiest is a patch that you put on once a day, and then using some of these short acting modes to help you with cravings. I think that's the best way to go about. Um, all right, next slide, please. All right. So bupropion, Wellbutrin, um, when marketed as a smoking cessation aid, it is otherwise known as Zyban. Um, they're all the same. So um, this is a very good medicine. We've been using this medicine for, I mean, quite a long time. I mean, probably 20 years or so, um, to help people quit smoking. It is an antidepressant. People are commonly on this as an antidepressant already. Um, but there are properties that help with addiction as well. Um, it is available in short acting medicine. It's a twice a day medicine, typically when prescribed as a smoking cessation aid. Um, you know, the maintenance dose or the typical dose is 150 milligrams twice a day. In order to start with the dosing, I mean, typically what we'll do is we'll use 150 milligrams a day for a couple of days, and then ramp up to 150 milligrams twice a day. Um, it's and then after about a week, we recommend people have their quit date. Okay, that doesn't have to be set in stone, but we typically will say quit after about a week after having started this. Your cravings should be helped by the time you've been taking this for about a week. We don't really know how it helps people quit smoking, but we certainly know that it it's it is a weak inhibitor of the uptake of dopamine, norepinephrine, serotonin, all neurochemicals that are involved in the pleasurable sensations and also addiction. Um, like any of the medicines, so either bupropion or Chantix, which I'll talk about on the next slide, um, there are some side effects that occur. The common side effects are dry mouth, insomnia. Also, I see kind of lightheadedness, just sort of feeling kind of loopy. I see that not uncommonly. But I will say that Wellbutrin is an overall well tolerated medicine. I think it's the medicines that we use. I do think it is the best tolerated medicine. Um, and essentially it just kind of reduces your desire to smoke, is what it does. Importantly, it can be used with nicotine replacement, so that goes back to what I talked about originally, which is you can use this plus the nicotine patch, or this plus um, the lozenge or the gum in order to help with cravings, and then you're kind of attacking that addiction but from a couple of different angles, which I think is, which as we said earlier in the talk, that's an effective way to do this, and probably the most effective way to do it. Um, And yeah, so overall, I mean, I often recommend Zyban to people. I don't. Oh, one drawback, I should say, one drawback is that people who have a seizure disorder, it's contraindicated for. So we would want to, if we would want to consider this, and you have a seizure disorder, probably discussion with your neurologist would be appropriate. Um, when people are on other antidepressants, um, I might shy away from it without discussion with a person's psychiatrist. I have used it in a, by adding it to someone's SSRIs, such as Celexa or Zoloft. And it is considered safe, but again, I mean, I wouldn't want to mix multiple psychiatric medications. I would maybe add it if it was one, but if you're on multiple, I would probably want to defer to a psychiatrist to ensure that that's appropriate from their standpoint. Um, but aside from those considerations, I do find that it's an effective medicine. I find that it's well tolerated. Um, Next slide, please. So varenicline or Chantix, this medicine is specifically for smoking cessation. It's been around for roughly 10 to 15 years, I think. We've got a lot of exposure with it. Of the medicines, I will tell you, it's probably considered the most effective. Um, However, I do not. It is in my experience, it is less tolerated. Okay, the way we will typically use it is we'll start with there's a starter pack, which is uh, you start with a lower dose than typical, which is 0.5 milligrams a day for 3 days. Then we increase that to 0.5 milligrams twice a day for the next 4 days. That's 1 week, of course. And then after that should be your quick date. Thereafter, you ramp up to 1 milligram twice a day. I should say that for all of these medicines, although there's no set rule, we usually use about 3 months, assuming that you do quit within that 3 months. There's no reason that you can't go longer than that if you have cravings and it's helping you. But typically we go about 3 months. Um, like I said before, this medicine binds the nicotine receptor in the brain, and it reduces cravings. It also just kind of makes, because that nicotine receptor is being taken up by varenicline, it makes smoking less enjoyable. So people just don't want to do it anymore. There is something with that receptor that leads to um, sort of dreams and things like that. And I can tell you that almost every person that I have prescribed varenicline to, it's actually quite interesting to me. Almost every person describes the side effect of yeah, strange, vivid dreams that they have. So, I mean, I do find that is like I said, very common. Um, some people don't mind. Some people are okay with it. I've had some that it's not as significant, but it is something that I always like to tell people because it is very common. I will say I've seen that a couple of times with the nicotine patch as well. So I do believe there's something with the nicotine receptor, and for some reason, Chantix seems to be have more of an effect as causing that side effect. Um, with that said, I mean it is effective at helping people quit smoking. Um, a couple of other things. Although historically we have thought that you really could not use nicotine replacement in addition to it. In fact, you can. So you can use a nicotine patch in addition to Chantix. That was something that we used to say when it first came out, but we've since sort of learned that actually you can, and it can be helpful to use nicotine replacement. The other thing that is commonly brought up with this medicine is that initially, when it first came out, there were some concerns that it could cause a lot of mood changes. You really shouldn't use it in people who have a history of depression or other mood disorder. Um, I don't want to say that's never been, that's never occurred, but I can tell you that we do know we do believe that it's safe to use this medicine in those scenarios. Although what I always typically will do is we do want to have um, I do want people to be aware that a change in mood can occur. I mean, there certainly have been cases where suicidal thoughts were brought on by Chantix. But with that said, I mean, initially there was a black box warning associated with this medicine, which I believe is not present anymore. I believe that was taken off several years back. Still a consideration. I don't want to discount it. Of course, it's very important, but I will tell you that that's something that is often brought up um, as kind of a hard stop for people. And I think as long as people are aware and aware and they have good contact with their doctor, it can still be done, and it's not as large a concern as it first was when the medicine came out several years back. So just a couple of important considerations. Again, I do use it, but there is some limitation with tolerability and side effects with Chantix. Next slide, please. Yeah. Okay. So combination therapy, again, just going back to what we had talked about before, single drug therapy with either Chantix or Zyban are fine. But when you add nicotine replacement to that, um, it's actually more effective. So I think if there's if there's something I want you to take away from this talk and this slide specifically, using more than one mode um, is effective, and definitely should be considered. So if your doctor offers you Zyban, I would encourage you to ask about the possibility of nicotine replacement as well. Because it can be very helpful, and Chantix as well. As I just use Zyban as a as an example. So just before I move on, I'm going to talk about some just side effects a little more broadly on the next slide. I do want to say that these are all I'm telling you about my own experience. I would encourage you to talk to your doctor about these things. I mean, none of these are blanket statements that this is right for you specifically, and this is a recommendation for you directly. I mean, definitely these are medicines that you should talk to your doctor about. There are other medicine interactions that might be considered that we're not considering here because again, everybody's medical history and medications that they're on are very complex. So definitely I would say talk to your doctor. The Zyban and Chantix are both prescriptions. Nicotine replacement is over the counter. So it certainly can be done, but I would still encourage you to talk to your doctor about it and see what their experience might be and if they have any hesitations with you beginning any of these things. Next slide, please. We're just going to talk about side effects a little bit. So I'm just going to talk about some common side effects. I've already brought that up with the bupropion and Chantix. But there are some side effects regarding the patches and nicotine replacement as well. Of course, the patch typically, I mean, skin redness is pretty common and it occurs in about 50% of people who use it. So that's just some skin irritation. The lozenges can cause irritation of the mouth, nausea, heartburn. Similar to the gum, it can cause kind of an upset stomach or some nausea. The inhaler and nasal spray can cause irritation to the mucous membranes. Like I said, the inhaler we're not really using as much. Hopefully, it does come back, but it can cause some irritation in the throat. The nasal spray can cause some irritation in the nose, of course. So all things that you might expect. Again, bupropion has dry mouth, some agitation, some difficulty sleeping. I've seen some sort of lightheadedness and things like that. Chantix has a little bit more associated nausea, insomnia, headaches, the abnormal dreams, honestly, very common in my experience. Behavioral changes, agitation, depression. And like I said, suicidal ideation, it has occurred, so I don't want to downplay it, but it is not very common. And as long as you have a good follow up with your doctor, um, I would consider it. If you have any concern, definitely talk to your doctor about that. And if you have a psychiatrist, most certainly talk to your psychiatrist about it. But in general, it is considered that is not considered a really high risk of this medicine. Um, let's see here. So next slide, please. So just finishing up the last couple of slides. Um, so compliance and convenience of therapy, I think that's a very important thing. The patch definitely has the highest compliance rate because it's once a day dosing. It's easy to use. The medicines, similar. They're twice a day, so there's pretty good compliance with those as well. The things that are more frequent throughout the day are a little bit harder. A little bit harder to stay with, but they're good as a mode in addition to medications or the nicotine patch. Cost is important as well. I mean, I believe most insurances cover smoking cessation aids because it's considered preventative care. But access and cost is certainly a concern. Fortunately, we have had some difficulties getting Chantix in the past. It's available now. The nicotine patches have not been a difficulty, and Wellbutrin is a common antidepressant, so we don't have any difficulties getting that. It's typically pretty affordable if there's any copay, but again, it is generally covered by insurance. Next slide, please. So yeah, just a little bit cognitive and behavioral treatment strategies. I mean, there are some support groups out there which can be very helpful to people. I mean, there is cognitive behavioral therapy, which can be provided by a certified psychologist or psychiatrist. These are things that can be very useful for people. It's similar to a 12-step program like Alcoholics Anonymous or Narcanon or what have you. I will say they're not as available, right? I mean, we would love to have our own smoking cessation program. I think that would be a terrific thing. But we just, they're just not in the community as much as we would like. But if there is availability that you know of, then attending something like this for group support is a good thing. And then alternative strategies, if you don't mind going to the next slide, please. So, there are some apps that are available. There's 1-800-QUIT NOW, which is very common. If you look on the, I think it's the Massachusetts DPH website, there are some resources there. Some other things that we didn't go into that a lot of people ask about, hypnosis, acupuncture, meditation, yoga. I mean, what I could say is anecdotally, people have found benefit, and so I don't discourage, especially hypnosis, acupuncture, because meditation certainly. I don't think there's a huge downside to doing it. With that said, the studies out there, the research that's been done really doesn't show that it's very effective. I've had plenty of people who have said I went to hypnosis and it helped. So again, I'm not against it. I also don't have a great way to refer people, which is a problem. But there are people who have had success with it. It is, I think, it's typically pay out of pocket, so it can be kind of expensive. But people who have used it have found good success. A word about e-cigarettes or electronic cigarettes. Some people have found them helpful to quit smoking. I mean, I always have a little bit of a moral dilemma with, is that something I would recommend or not? I mean, my take has been, well, truth, if you quit smoking with it and you quit vaping, then it's probably a good thing. But we do know, and Chris is going to talk about electronic cigarettes a little bit. What we do know is electronic cigarettes, it can be very dangerous, and even in the short term. And so it's hard to make a recommendation to vape instead of smoking when there's most certainly could be a long term problem with vaping. But I'm also concerned that there could be short term consequences as well, and we just don't know enough about it. But again, anecdotally, people have used vapes to help them quit as well. Um, but something if it's a last resort, I'm not against it, but it's not something I have recommended certainly as a first line. Um, so again, make a plan, set a quit date, talk to your primary doctor. I of course talk to my patients about it as well. If you happen to be one of my patients, um, we want to avoid triggers and factors that get rid of the temptation. So make it harder on yourself. Don't have ashtrays present. Don't buy cigarettes. Obviously, people will break down and buy them, but if you don't have cigarettes in the house, it's a lot harder to smoke, right? So you want to make it hard for yourself. But again, think about the ways quitting will help you and improve your life. Think about what you've learned from past attempts, and don't give up, because again, the more you try, the more likely you are just to quit. And I've had many people who have quit after trying for a long time. Um, and again, the next slide, Michelle, is just about 1-800-QUIT NOW. Again, there are some resources on the Department of Public Health website which you can look up. But 1-800-QUIT NOW is a good quit line hotline that can get you connected with some resources, and also to get some support over the phone. So that's a good thing to have available to you. And again, the next slide is just some more resources. And I think that's all I have about therapies and quitting. I kind of went a longer than I thought I would. I always have way more to say than I think I might. But anyway, I hope that was helpful. And if you have any questions, Michelle will let us know and raise them. Chris, if you do you want to talk about those? I think you have 2 slides about vaping, because it's such a hot topic. We thought we would get a few questions about it, so we figured we would discuss it a little bit at the end here.
Yeah, sure. Thanks, Ryan. Fantastic information. I really appreciate all of the information you provided in the webinar here. And again, I would only echo your thoughts. I really hope that the information that was provided here was a lot of information, but a lot of really good information that should really help people in their journey. And again, Ryan and I did think that, just to preemptively for a couple of minutes at the end of this talk about vaping, because that seems to be a very common question for us in our office setting when we're seeing patients. It's a tough topic because there are so many people that have turned from cigarette use to vaping, and a lot of younger people are now using the vapes. It has become the kind of next wave in tobacco or non-tobacco use, but nicotine use. The sales have escalated faster than even historically related cigarette sales, and the problems with it is that it's not very well regulated, and the additives in the vapes are not really well known. Some of the vapes have synthetic nicotine. There's some suggestion that there's adverse chemicals that can cause even more harm than cigarette smoke in some of the vapes. So there's a lot more study that I think needs to be done. Michelle, you can go to the next slide if you don't mind. And this is just more of a summary of what I was just trying to come across as saying about the e-cigarette. The bottom line is, I would echo what Brian said, that it's as a last resort. Perhaps it could be considered for someone who has tried all other modalities and is looking for something to help them quit smoking for a short period of time. But again, due to the adverse effects of using a vape on the underlying lung tissue, and the unknown effects of vaping, we certainly can't support that as a viable alternative for someone who's on the smoking cessation journey. But again, feel free to ask any other questions about vaping in the question and answer sessions. And again, thank you all for attending this evening.
Excuse me. Thank you. Thank you both very much. We do have a couple of questions. Is it harder to quit the second time around? I was able to quit once cold turkey, literally one day for the next, and started stop for 18 years. However, 4 years ago, my 26-year-old son passed away very suddenly. I started smoking again and just cannot seem to be able to stop this time around.
Yeah, Chris, I don't know if does it get easier or harder with time? I honestly don't know the answer. What I could say is it might be harder if life circumstances change. I mean, I would say that. I would say that would certainly make some sense to me. But do you know, Chris, has there ever been anything that where it gets harder to quit after after trying once, or with age, is it harder to quit? I don't think so.
Yeah, it brings up a great question, and to the person asking the question, I'm very sorry to hear about the loss of your son. The stress from that is unimaginable. Uh, in the training that I did for smoking cessation as a counselor, the one interesting fact that they brought up was that question about the second time quitting, and in fact, it is much harder to quit the second time. Whether your motivation is different, whether, as Dr. Shipe outlined, there are new stresses in your life or circumstances that have changed, it does get more challenging the second time around. With that being said, it's not impossible. You already clearly, by logging into this type of webinar, have made it clear that you would like to quit. While it is harder, it's not impossible. There's a lot of support structures out there that have been outlined in the webinar this evening, and maybe something that worked for you last time may not necessarily work this time around, but there are alternatives that may work differently for you that you can try. I would certainly say the first step is always your willingness to quit. Setting a date, trying to get through the stress or the circumstances that caused you to start smoking again, and then reach out to your primary care physician and say, look, I really need some help here. I want to do this. What can I do? What are these options available to me?
Yeah. Yeah, that's
Another
a great
question. Oh, sorry, Dr. Shipe.
Oh, no, I was just saying that's a great question. I honestly didn't know the answer. Yeah, so that's really helpful, Chris. Thanks.
Another question is, I'm going away on vacation. Should I wait until I get back to start?
Yeah, that's a great question. Vacation or any time where there's sort of celebration, relaxation, it's a tough time to say, you know what, I'm gonna stop smoking during my vacation when I have all those temptations there, and I just want to relax and have a good time. Uh, that's a very personal decision. There's for some people, there's never a good time to quit. I think it goes back to the bottom line of setting a date, sticking to that date, whether it's before a vacation, after a vacation, and just saying to yourself, "This is when I'm going to do it," and stick to that date. Ryan, what would you think?
Yeah, I agree with you. I mean, I think it's a personal decision. With that said, I mean, I think it's an opportunity, right? I mean, to go back to some of the things that I was saying, it kind of depends on where you go on vacation, but you could make it harder on yourself to smoke, right? I mean, meaning you could purposely not pack cigarettes. You could purposefully, have somebody else go to the store and not get them, and remove all of that temptation. Also, I could imagine a scenario where you would be distracted by the vacation, and you might not think about it as much. So, not saying you should absolutely do that, but I could see the benefit of making your quit date the first day of vacation. And if you were interested in using the medicines a week before, starting the patch the day the day you go away on vacation, that actually is that might be a really good place to start. Of course, it's up to you. I don't think there's a right answer, but I think that's where you have to kind of go back to, you know, what scenario is going to make you most likely to succeed, and if you engineer that scenario, I think you could really help yourself by doing it on vacation. So yeah, it's interesting.
Okay, we do have another question. The vapes that say no nicotine, will those help to get rid of the nicotine craving?
I think, go ahead, Ryan.
I was going to say, I don't think so. There may be something else pleasurable about it. Maybe the warmth, or having something in your hand. Maybe if it's flavored or something. But if there's no nicotine in it, I mean, it should not help with nicotine addiction specifically. I don't know, Chris, have you come across that at all?
No, I haven't. I think one of the big problems with some of the quote unquote nicotine free vapes is it's somewhat of a misnomer, because they actually contain a synthetic form of nicotine. So I think
Yeah.
it's kind of a backdoor way of them selling you a product that says that it doesn't have any nicotine in it, when it actually has somewhat of a synthetic product that is similar to nicotine. So I think people have to be very careful in terms of their selection if they are vaping, that there are products that may be in there that are not well outlined. And it goes back to what I said previously. These things are so unregulated that it's very hard to determine exactly what is going into your body through a vape, because there's not a lot of regulation. So um, again, we can talk about this a lot, but I think the bottom line is it's very dangerous. It's not really well understood, and it's not a great way to quit smoking. I'm sure you would agree, Ryan. I think you already outlined that.
Oh yeah. Without it, yeah. I mean, as I was talking, I kind of thought the same thing. I mean, this is I don't want to throw the vape business under the bus, but this is not a I'm not sure if it's a really honest business, right? I mean, if they say nicotine free, I think that's a marketing thing.
Yeah.
And I think that might be but I'm not sure. I'm not sure how straight up it is. I'm not saying they're, so they might have something like synthetic nicotine or something else. So yeah, I just don't think you know what you're getting, when you buy these. I think that's the issue.
Right.
And the last question, will attendees have access to this recording should they want to get the information again? So I can actually answer that. And yes, along with the survey that'll be going out, we will send the attendees a link if they would like to rewatch some of this information. That's
Very
it
great.
as far as the Q&A.
Awesome.
Great.
Thank you, everybody, for joining us, and especially to Dr. Ryan Shipe and Physician Assistant Christopher LeSiege. Thank you for joining us, and hope you all have a very good night. Thank you.
Have a great night. Thanks,
everybody.
everybody. Happy holidays, everyone.
Bye-bye.
Bye-bye.